Hi everyone, after that stretching, how do you all feel? Good?
Okay, so this topic really is healthcare management careers for doctors, how to succeed in healthcare differently. Now, many of you are looking for answers in terms of your next career options. And I see a lady over there who I met earlier, and that's exactly what she's here for. What we're going to try to do is, as you can see, Disruptive Doctors is not your normal, boring medical conference. So this is really about being interactive. And what we're going to do is really to start off with and ask each of our distinguished panel to give us a 3 to 5 minute intro about themselves and their organizations and what they do. And then after that, we're going to break out into talking about the various opportunities within healthcare management that's away from you treating patients. And then there's also a hybrid where you can keep treating patients, but also are involved still in management. So different options, we're going to discuss that. We're going to cap it. We have an hour and our managed time. We're going to cap the conversation to half the session. What we would like to do, and of biggest benefit for you all, is really ask these people questions, because they will provide practical, honest opinions. So whatever stereotypes or perhaps theoretical concepts that you had in your head, they're going to debunk them. So for a start, I'm going to start with Dr. Rahman over on the other side, since he's way over the other side. Dr. Rahman, over to you, please. 3 to 5 minutes only, each of you. Thank you.
Honestly, I thought you'd start from the closest. So I was quite relaxed and not prepared. Anyway, good morning, everyone, and thank you again to Disruptive Doctors for this conference. I think I was here last year as well, and thank you for having us again. Brian, not to take more time, the healthcare management career for doctors is a very interesting topic. I think a lot of doctors are looking for other areas. But one of the misconceptions that most doctors have is that management is easy, right? They have a 9-to-5 job, they get a work-life balance, and so it's something that they want to do, and they think their current place in the hospital is not conducive.
I was exposed to healthcare when I was young. I used to follow my dad to the hospital for his ward round. He's a doctor. And that developed my interest in medicine. But it was in later years when my mom was diagnosed with cancer that I was very sure I wanted to be a doctor and I wanted to make a difference in people's lives. So when I applied for uni, I only applied for one course, one university. First round, I didn't get through. I had to wait for a second batch, and I managed to enter medicine in Australia. And after I completed medicine, I actually wanted to come back to Malaysia to work, but the application was very long to get myself registered with MMC. After some time, I decided to try Singapore. Within a day, I got a job offer. Within a week, I registered myself with SMC and started working in Singapore. So I completed my internal medicine training in Singapore. I remembered my housemanship. I hated it. I felt worthless. If there's a caste system, I was in the lowest caste. So after my housemanship, I actually took a month off because I questioned my decision to be a doctor. And unfortunately, doors were not open for me in healthcare management or health policy, etc. So I decided I needed to complete my medical training.
All right, let me just disqualify myself to what Raymond said, just in case there are CCAPS officers around. I love CCAPS. Please do not delay my applications, all right? I'm Kamal. I'm the CEO for Gleneagles Hospital in Johor. I'm also the regional CEO for IHH Healthcare Malaysia. IHH Healthcare is one of the largest integrated healthcare in the world. We have 17 hospitals in this country. The names like Pantai, Gleneagles, Prince Court. We recently acquired Timberland in Kuching. We are building another 300-bedded Gleneagles in Kuching. So I started my journey as a medical doctor in Kuantan Hospital Tengku Ampuan Abzan. That was in 2007. I took my master's in public health in Liverpool. I came back to a company called Sabah Forest Industry, where I was the public health physician looking after the health and well-being of 5,000 employees plus family, right? After 2 years working there, it was in Sipitang. Sipitang is a town in Sabah that is very close to Lawas. It's in the middle of nowhere, right? So I thought, okay, I want to come back to Peninsula, so I have to move back closer to the airport. So then Gleneagles Kota Kinabalu opened in 2015. I joined them as the quality manager. I helped the CEO open the hospital and license the hospital in Gleneagles Kota Kinabalu. That was in 2015. After 8 months, they decided that he has too much time on his hands, so they moved me to corporate in KL. I was the head of medical affairs and quality for IHH Malaysia, looking after accreditation, licensing, medical legal issues, accreditation of doctors for, at that time, 15 hospitals or 14. I was there for 2 years before I moved to Gleneagles Kuala Lumpur as their chief operating officer. I was there for about a year. Then pandemic came and they needed help in Batu Pahat. So I moved to Batu Pahat and I spent there for 2 years as their chief operating officer before Gleneagles Medini required my help, and I've been with Gleneagles Johor ever since. So I've been the hospital CEO for 4 years, and I was recently made the regional CEO, overlooking the southern and eastern regions of Malaysia, covering Malacca, which means Pantai Aikoro, Pantai Batu Pahat, Gleneagles Johor, Timberland Hospital, and Gleneagles Kota Kinabalu.
Okay. Good morning, everyone. I'm very happy to be with you here today and among very highly regarded panelists. Well, I did not work overseas, nor did I have to travel the whole of Malaysia. I am the medical director of Damansara Specialist Hospital. Damansara Specialist is one of 5 flagship hospitals in the KPJ healthcare group. IHA is big, but KPJ is a homegrown brand. Okay, we are the biggest homegrown brand healthcare in Malaysia. Kena sell lah sikit, right? That's what you wanted me to do, right?
I will defend Dr. Kamat. IHH is also homegrown. It's a Malaysian company.
Okay, I'm just keeping it light. This is a giant, okay? They are giants. They are becoming gianter, if there is a word for it. So KPJ is homegrown. You've heard of KPJ. We've got 30 hospitals in Malaysia. Okay? So, my journey. I was telling Hui Ling, don't know whether it's paksa rela or not. It started when I was hired by Damansara Specialist as an emergency physician. So they wanted me to revamp and troubleshoot problems in the emergency service. Fortunately or unfortunately, I was the first EP in the group. So not only did I have to work for the hospital, I was also asked to, do lah for this hospital, come up with policies for this hospital. That was the first few years of my life in private healthcare. So that was okay because thankfully during my master's training, master's in emergency medicine, we were trained in some administrative work. So setting up services, departmental planning, a bit of recruitment, a bit of procurement, but not very much in financials. As you all know, when we go into private healthcare, financials is really, really important. It's all about the money.